Good afternoon. My name is Aileen Torres. I am one of the leaders for the Urgent Care Center. I am here today to discuss one of the areas of concern that we will be working on improving, which is the patient satisfaction for our center, patient satisfaction scores. At the moment, our patients are receiving this Press-Ganey survey. This is a way that we measure the patient satisfaction for our center. It has different sections with questions pertaining to each section. The different sections are arrival, nurses, care provider, tests, family or friends, registration, personal issues, and overall assessment. Specifically, in regards to the patient satisfaction, I will be focusing on the area of courtesy. Courtesy is something that patients do find very important. How courteous the staff is, how helpful they are towards the patients as well as the patient's family members. So we will be working on improving this level and working on implementing best practices that can be used in our center. One of the things where it starts actually is at the registration. The patient representative that welcomes this patient in registration, they are basically the director of first impressions. The patient is expecting to be welcomed and maybe treated as family. Being treated as family would be that little bit of that little extra that makes it extraordinary, that makes the service extraordinary. So we encourage our registration staff as well as everyone else to treat the patient like family, to be courteous, which ties into making them comfortable, offering them a warm blanket if they're cold, offering them coffee, maybe crackers if they're feeling very uncomfortable, maybe speaking to the clinical staff to see if we can bring in the patient sooner, keeping them informed. So being courteous is not just saying, "Hi, how are you? How can I help you?" There's more to it. So we're educating our staff in order to improve this. So here's the survey. This is something that the patients will be receiving, and we do remind the patients about this survey and inform them with the thank you card. So this is something that they receive at the beginning of their visit, but however, it goes to each staff member because they do have to write their names. This is a way for the staff to be able to basically let the patient know who they are, who has been helping them today. So it's your way to remind the patient of who you are so that when they do receive the survey, they can basically list their names. So at the end of their visit in our urgent care center, the staff member will say, we thank you for choosing our center, for coming here for us to help take care of you and treat you. We always strive to give very good service and always take any feedback. We take that in order to be able to improve and find ways to make it even better, to make it legendary, a legendary type of service. So this is a great tool. We will be implementing this. It will be a way in order to raise our patient satisfaction scores. So this is something else that we will be using. Again, it's something we're working on. There are other areas that I do have other leaders that are part of this team for our urgent care center that will be working on different areas where we might be struggling as well, where patients they've showed that they're very concerned about that. So it's a work in progress. Thank you.